and that's an irritant, and so you'll cough that up. What's something else that you can get that causes you to cough up blood that a lot of people in third world countries or in outside the U.S. will maybe get? So like, and it's a type of infection.
I'm not totally sure. TB is what everyone else is saying.
TB, yeah. Okay. So tuberculosis. So tuberculosis can imitate a lot of different things. It can look like a bunch of different diseases. And so whenever somebody comes in and they say they're coughing, you want to ask if they're coughing up blood, because the last thing you want to do is get tuberculosis.
Yeah, of course.
So yeah, perfect. Good job. So where is that? Is there anything else in the history that you would be worried about? Or actually, to make it a little bit more straightforward, why did I tell you that there's no anosmia, Dr. Alamin?
I'm not sure, but maybe it's not related to like a more serious infection, possibly.
So yeah, so anosmia is the lack of
no.
My teammates are having trouble accessing the live stream. Mine too. Okay. So we'll get that sorted out. Sorry, guys. Right? So what's something going on right now that people are really worried about that can cause lack of smell, that we're all socially isolating for?
Coronavirus.
So COVID can cause anosmia. So it's important to know that she doesn't have those symptoms. And so, perfect. Thank you. So Dr. Dow, Summer Dow, I give you history right after that about the daughter-in-law, son-in-law, and the 2 grandchildren. Why did I give you that history?
I think you gave us that history just for the social construct, to see how she lives her daily life and see like if her symptoms reflect how she lives and what could be wrong if her daily life changes from what it was to what it is now, since she's had the onset of symptoms.
Okay, so definitely having that social history is going to be super important. But on the same thought of COVID, why did I give you that the work history of her daughter and son-in-law?
Maybe to see if they picked up anything from their workplace, brought it back to the house. I'm not sure if that's kind of where you're going with that question.
That's exactly where I'm going with that question. So, so right now, especially if you guys are working as scribes or anything like that, definitely be very cognizant of the risk of exposure to COVID. So that's why I gave you that history. One of the other students in the last class brought up that if both her daughter and her son-in-law are working, is she by herself a lot of the time? And that's a really great thought. So Dr. Palak Pandya, why is that important to know if she's by herself a lot of the time? Okay. Then let's go with Rani Patel. Why do we think, Dr. Patel, why do we think that, why would we want to know if she's alone a lot of the time?
Because there's no one there to like really take care of her.
Okay. Yeah, so if there's nobody there to take care of her, then and she's alone a lot of the time, what is she at risk of, Dr. Salama, Sarah Salama?
I think she might be at risk of hurting herself because she has dementia as well.
Yeah.
And she might be at risk of, just overall hurting herself.
Yeah, hurting herself, falling. The other big one is if she's eating and she chokes. So
That's it.
if she chokes on something, if she's eating something and she chokes, where does that food go?
It could potentially go to the lungs, I think.
It can go into the lungs. Yeah, perfect.
Area.
And so if it goes down into the lungs, what can it cause?
Potentially infection.
Yes, perfect. All right. So she has a history of hypertension, uncontrolled diabetes, hyperlipidemia, coronary artery disease, chronic kidney disease, and dementia. So Dr. Guerrero, out of all of the history that I gave you, what are you most worried about? Oh, okay. So then Dr. Yasmin is saying CAD. So Dr. Yasmin, definitely you are right. But is there anything else in there that you would be concerned about?
Potentially the hypertension as well, and the 2 stents that she has had placed, since that just shows that she has had cardiac issues in the past.
Okay, perfect. What about her diabetes?
I think potentially all of the diseases together could cause a lot of issues. The diabetes could potentially be a problem because it's uncontrolled, so she could have excessive high blood sugar.
Okay. So so when you have uncontrolled diabetes, it affects your vessels. So you're going to be more at risk of having more narrowing of the vessels. And the other thing that you worry about is infection. When you have uncontrolled diabetes, you're at high risk of infection, and you have a harder time clearing that infection too.
Don't you also,
high blood sugar?
Sorry, I didn't mean to interrupt. Don't you also have like poor circulation as well with diabetes?
You can, yeah, and so that goes along with the narrowing of the vessels. That if the vessels are more narrowed, you're going to have poor circulation, and you can have a lot of these issues. Dr. Alamin is asking, could the blood sugar be causing confusion? So, Dr. Alamin, what are you thinking about? What disease process are you thinking about?
I'm not entirely sure. I just remember learning about that at one point.
Yeah. So, diabetic ketoacidosis. So, when your blood sugar is super high and it causes, and you are unable to break down those blood sugars, you start making keto acids, which causes your blood to become very acidic, which causes one of the symptoms is confusion. Now, you would typically see blood sugars like in the 500s, 600s, and it really depends on where her blood sugars are normally. But yes, that's a really good point. Okay, so Dr. Abigail Sippel, I apologize if I mispronounce your name. I gave you her medication history. What in the medications would you be concerned about for confusion?
For confusion, well, I mean, one of the things I definitely would worry about would be like the fact that she's taking Advil with all the other medications she's taking. I'm not sure if that would cause confusion.
The one with the confusion that I missed half of what you said, so I'm sorry. The glipizide is the one that I wanted to highlight because do you know what glipizide does?
No.
It's okay if you don't. So glipizide is a medication we use for diabetes, and it decreases blood sugar.
Mm-hmm.
So if she's confused, she's by herself at home potentially. What's something that could have happened that can cause worsening confusion?
I'm sorry, I missed like half of that. You cut out. Sorry.
So if she's at home by herself, let's say she takes her own meds, and she is confused. If she takes too much of her meds, or she forgets that she took it and takes it again, she can potentially drop her blood sugar a lot. And so because of that, you always want to check your blood sugar. Now we know that it will that her blood sugar was high, so that's not an issue. But that's always something to look at, because one of the most common causes for people to have any issue is medication error. So,
And I just want to make sure, but the medication for her hypertension, doesn't that cause dehydration too, if you're not careful?
It can. The hydrochlorothiazide is a diuretic, but it's a weaker diuretic. We would probably see her blood pressure drop more so than be really dehydrated.
Okay, thank you.
Yeah. Okay. So could the diabetes being uncontrolled contribute to confusion? Doesn't she have a history of dementia? So yeah, she has a history of dementia, but when we're talking about her dementia, she has a change in her baseline. So her baseline dementia is, where she normally is. She's able to function at her baseline, but then on top of that, she's more confused for the daughter. So just looking at the comments here. Okay. So, all right. So Dr. Wumi, I gave you her vitals. So her blood pressure is 158/93. Her heart rate is 110. Respiratory rate is 24. Temperature is 100.5, and she's satting 93% on room air. Can you interpret those vitals for me?
Her white blood count cell is like really high, so
Okay.
that probably has to. Oh, go ahead.
Focus on the vitals.
Oh, okay. Or her BUN and CR are really high, so that has to do with her like chronic kidney disease.
So yes, but when we're looking at like the blood pressure, the heart rate, the respiratory rate, the temperature, and the oxygen saturation specifically, so let's take her heart rate. So is that a normal heart rate? 110?
It's high.
It's high.
Yeah.
So there's something that's causing her heart to work harder, right?
Yeah. Probably her breathing.
Maybe her breathing, yeah. So her respiratory rate is 24, so that's high as well. Her temperature, is that normal? 100.5?
No, it's high. She has a high fever.
Yeah, so she has a fever. And then her oxygen saturation. This one's a little bit trickier. Is this normal or no? 93% on room air.
No.
No. Perfect. Normally we would be around 95 and up. Usually if you're healthy young, we should see you like 98, 99. So the 93 on room air is concerning. If she had a history of COPD, and it's okay if you don't know this, but if she had a history of COPD, would this be normal? The 93 on room air.
I believe so, but I'm actually not sure.
Okay, so perfect. So yeah, so it can be normal for them. So COPD patients, typically the normal that we aim for in the hospital is between 88 and 92, because when their oxygen becomes too high, they lose that respiratory drive. And so we want them to be a little bit, I wouldn't say hypoxic, but we want their oxygen to be lower so that they're not, so they don't retain as much carbon dioxide and become acidotic. Not anything pertinent to our case here, though, but it's just something maybe for the future. So for the exam, instead of going through the entire exam, let's see, Dr. Brinkley, what are some of the things that you noted in the exam? Dr. Maha Name. What are some things you noticed in the exam?
A couple things that I noticed in the exam are the fact that it mentions and specifically in the head, eyes, nose, and throat, there's tacky mucous membrane. So that might give some insight into how the coughing and like how she was saying that there was no productive cough. It's interesting to see that it has some, like she has more mucousy membranes, and that might play into it. And then also in regards to the respiratory part of the physical exam, she has tachypnea, so that means she has like more faster breathing, and that might also play into how she's having difficulty in breathing. And in regards to the part of her chest where we were saying earlier the pleural lining might be slightly aggravated when she's breathing, and then they're also mentioning crackles, so that could also play into how something related to the chest area, how it might be rubbing against something near the lungs.
Perfect. Okay, so let's go through each of those. So tachymucous membranes. What that typically means is that the mouth is more dry. So what would that be indicative of?
She's probably not consuming any fluids or not drinking as much or eating as much as she's supposed to, which is likely because it's painful.
Not so much that it's painful, because she did have a sore throat. You're right, but the sore throat got better.
Okay.
But like kind of like what we talked about earlier, when you feel ill, a lot of times you're not going to want to eat, you're not going to want to drink. So a lot of patients that come in when they're sick, they are a little dehydrated as well. Lily's asking, should her blood pressure be better controlled with her hypertension medications? Yes, they should. But when there's an acute process going on, a lot of times they'll have a little bit of a higher blood pressure. But okay, so you mentioned the tachypnea, the increased work of breathing, and the mild crackles. So does this feel more like a heart issue, a lung issue, a belly issue? What do you think?
I think in regards to if it's cardiac or if it's more respiratory, since she didn't have any like jugular, or I think it was like the veins, there was no actual distension of it. It might cross out certain possible cardiac causes, like,
Okay.
but I believe it's pericarditis. I'm not 100% sure.
Okay, we'll get there.
But yeah, in terms of the respiratory, I think it might be more related to the lungs than it might be the heart.
Perfect. Okay, and then all right. So Dr. Kendall Johnson, she is tachycardic. What does that mean to you?
Her heart is having to pump blood faster and harder in order to get the oxygen out that's needed.
Okay, so does that mean anything specific to any process? This is a little bit of a harder question because it's like kind of tell me what I'm thinking. But is there anything that you would specifically be worried about for just based on the fact that she's tachycardic?
Could it be like enough oxygen getting to her brain?
That wouldn't necessarily cause tachycardia.
Right.
Dr. Walker is helping you out.
The pulmonary. Oh, it went away. Pulmonary embolism.
Yeah, pulmonary embolism. The most common sign of it is tachycardia. But just with if she had a infection, would she be tachycardic?
No. Wait. Yes.
She would if it was very severe.
Right.
So perfect. Okay. So does the S1, 2, 3, 4 parts of physical exam have to be PQRST? Maybe. Okay. So Dr. Dow's asking about the S1 and 2, 3, and 4. So those are all heart sounds that have more to do with the valves. And basically, it's normal for her. So we'll talk about that probably in the future. Okay. So, perfect. So, Dr. Laura Castillo, so look at her CBC first. Is there anything in there that you're worried about?
Well, the white blood cell count is really high. It's 16.9K. That's like really high.
Okay, so what does that tell us?
There might be like some inflammation going on in her body.
What do you think can be causing the inflammation?
With all the rest of like was said before, the pleural cavity might be like inflamed, so that's why you hear the crackle sounds. So yeah, that's why I thought it was pericarditis at first. Pericarditis. Okay.
Good. Anything else that is not anything else? Is there anything else that can cause a high white blood cell count like that?
I just know that it's probably inflammation. That's all I know.
Yeah. So inflammation for sure. And the answer is yeah. There's a lot of things that can cause a high white blood cell count like that.
Oh, also like certain medications as well.
some medications, any medications that you know of that can cause that?
Could it be like high blood pressure medications as well, or not really?
Not the ones that I know. No, I don't think any of the medications she's on would cause. None of the ones she's on would cause a high white count. But yeah, so you have me looking at it, so I didn't even think about that. So that's a really good point. Steroids. So anytime anybody's on steroids, their white blood cell count will go up. So that was a very, very good point. Are you worried about her platelets at all?
Not really. Like I checked on the website and it said that it was normal range.
Yeah, cool. All right. So, Dr. Kavi, take a look at the BMP. Is there anything in there that you are concerned about? Okay, so Dr. Samia Abdullah, sorry. You asked about stress or Advil. I don't know. I don't know if you're talking about her white blood cell count, but typically no. But looking at her BMP, Dr. Abdullah, what do you think? Is there anything in there that you are concerned about? Anybody can, okay. Anybody can jump in. If you are able to talk, that's okay, Dr. Abdullah. So the potassium, the BUN, the creatinine, yeah. So Dr. Zoe Umar, talk about her BMP a bit.
Yes. I would like to say her BUN number is really high.
Uh-huh.
That could probably be an issue with the kidneys.
Okay.
Sorry about that.
No, go for it.
And she has a really high glucose level, which could be a problem because she has diabetes.
Okay. What about the creatinine?
That as well is high as well.
Okay. So she has chronic kidney disease though, so her creatinine's always a little high. So how would you interpret her creatinine if you know that?
Usually high creatinine causes nausea and diarrhea, so it's kind of in with her symptoms.
So her baseline is 1.1, right? So normally when you check her labs, it shows that her creatinine is a little bit elevated, it's 1.1, but now it's 1.8. So it's higher than she normally is, right? And so when the creatinine is higher than it normally is, that tells us that there's an acute kidney problem going on. There's something acute within that's happening to the kidney that's causing injury. So we have the creatinine being a little bit elevated. And so let me see here. Dr. Reynoso, are you here?
Yes.
So talk a little bit about her troponin.
The troponin, well, it's higher than normal, but it's towards like the higher end of being okay, but we are worried about possibly indicating cardiac risk, especially given her history and the fact that she's taking the aspirin every day for its cardioprotective properties, we're assuming. So I feel like that's worried. The elevation indicates just a higher risk, or we should be more concerned about a cardiac event.
Okay, so she has some type of cardiac injury going on, right? So the troponin's a little bit elevated, tells us that, yeah, there's something going on with the heart. Now, is this level of troponin something that I would say, oh my God, I need to do something about right away?
No, it's just something that we're concerned about given her history, and it's towards the higher end of healthy or normal that we wouldn't like to see.
Yeah, so that was, yes, so perfect. So the answer is it depends, because if her troponin is 0.07 and she had a story that sounds like cardiac chest pain where she's exercising, it gets worse with exercise and now and getting better with rest or nitroglycerin, or she's having crushing substernal pain, then yes, I care a lot about the 0.07 because that might be early and we might be getting it the results super early, and if we repeat it, it would go up. But for her, does her story sound like it's a cardiac chest pain issue?
It sounds more of a respiratory chest pain issue, just because she does get some relief from not doing her normal everyday activities.
She gets some relief by doing her. So
like her way to avoid the chest pain is by not doing her walk around the block.
Yeah. So yes, potentially. We don't know that though, because she might be doing that just because she doesn't feel like it. She feels sick. So if I were to recheck her troponin, do you expect it to go higher or lower for this patient?
I would expect it to probably go lower a little bit, not a lot, but a little bit, just because of her age and all her underlying medical conditions.
Okay, perfect. So Dr. Eric Morjan, sorry if I mispronounced your name. With that level of troponin, what would you want to get next?
I would consider an EKG because, because I mean, she hasn't had any other signs of cardiac problems, but it's still obviously a possibility. So getting EKG will show if there's any problems with the elevations in the XT waves or inversion.
Yeah, so if we have signs of a heart attack on EKG, so ST segment elevations, depressions, T wave inversions, we would definitely worry more about the troponin. Let's say that we got the EKG, or actually, let's say that we repeat the troponin in 6 hours and we see that it is now 6.0. What would you be worried about?
I would definitely be worried about a myocardial infarction because that's a very high level.
Yeah. And then what would the EKG probably show?
Probably show the ST elevation.
And what would you want to do for that patient?
Maybe do nitroglycerin, try to see if that helps. But since it's very high levels, maybe that's not like the most emergency treatment. I'm not exactly sure.
Okay, that's okay. So we have a patient where the troponin went up, and it went up to a super high level, and we see ST segment, let's say, elevations. So she's having a STEMI, right? So Dr. Saini is helping you out. What would you want to do next?
An angiogram.
An angiogram. So you want to place the stent in there. So you want to do an angio, see if there's a blockage, see if you can put a stent in there, because time is myocardium. So as soon as you see that, you want to rush them to the cath lab to get them stented if possible. Perfect. So Dr. Jasmine, you probably have the harder question. I am going to share my screen right now, and I want you to interpret the x-ray for me. Give me 1 sec. So, can you interpret this x-ray for me?
I'm not completely sure about this one, but it kind of looks like there's some cloudiness to that. That's the right side, so the right lung, some opacities. So that probably indicates that there's some sort of infection or something, possibly, or fluid.
Okay. Yeah, so you're talking about that thing that I just circled, right?
Mm-hmm.
Okay. So the way that we'll go through how to read x-rays a little bit more, but the quick and dirty way of reading X-rays is to look to see if the sides are symmetric, right? So if you look on the left side and the lungs look really clear and there's not a lot of stuff going on there, there's no like real whiteness, you can see the diaphragm border really well, and then you compare it to the left side and you see like up here it kind of looks the same as up here, but then when you come down here you see that there is a definite difference between that side and this side. Then you can say, oh, there's probably something going on in this area right here. And so you're right. So this looks like there's some type of infiltrate into the area, and it looks like this might be some type of consolidation. So that was perfect. All right. So I'm not going to call on anybody else. You guys can jump in. But what do you think is the most likely diagnosis in this patient? Actually, I will call on people. Dr. Jimenez, Karina Jimenez, what do you think is going on with this patient?
I would probably say that she has pneumonia.
Why is that?
Just given the cloudiness in her lungs, pericarditis came up as one of the possibilities earlier, but her heart looks pretty normal. It doesn't look super round or anything. Her symptoms tend to point to something respiratory, and it could be an infection that affected her right lung a little bit more.
Okay. Okay, perfect. So you mentioned pericarditis. If you were concerned about pericarditis, what imaging would you get?
I would probably end up getting an echo.
Perfect. Yeah, if we get an echocardiogram, do you know what you'll see?
Would you see that the heart is like very enlarged and like the chambers would be, or not the heart itself, but I'm actually really not sure exactly what I would see.
Okay. So the cardia. The second part is we'll see. Sometimes you can see some fluid between them. That's not always the case. If you're thinking about temp, have a shadow on her. All right, patient did. Oh shoot, my camera's off. So this patient did have a pneumonia. She was treated. Actually, Dr. Jasmine, what should we treat her with?
What should we treat her with?
Yeah, what would you
Is that
treat her
asked?
with? Yeah.
Maybe some sort of antibiotic if we're thinking something bacterial, like some sort of infection.
Mm-hmm. Yeah, exactly. And do you know the antibiotic you would use? Okay, if you don't.
No, I'm not sure.
Okay. To know that, but typically when they come into ER, sometimes they'll get ceftriaxone, azithromycin, and it's all dependent on what you're trying to cover, and we'll go over that in the future as well. Somebody asked, does she have sepsis? So, Dr. Matthew, do you want to explain that question for me?
So, because of her altered mental status, I'm wondering if she's septic. Also, which could have led to the, which could have been a cause of the infection.
Yeah. So, her vitals, what in her vitals would tell us that she is septic?
I'm not actually quite sure.
So there's a specific criteria for sepsis. So you have an elevated white blood cell count, you have tachycardia, you have elevated respiratory rate, and you have a elevated temperature. And so you have to have 2 out of those 4 to be considered SIRS. So it's systemic inflammatory response syndrome. But if you have those and you have a potential source, then you can call them septic. So That was a really good question. So for the pneumonia, figure out the type. You can do a sputum culture and determine antibiotics. You can, but a lot of times sputum cultures aren't very good. So we typically just treat empirically. We'll also get some blood cultures and make sure that they're not bacteremic. So there's no blood in the there's no infection in the blood. And if they're getting better, then we can send them home. Wouldn't this have to be a really bad infection, worse than pneumonia, to be considered septic? No. So you can be septic with a pneumonia. You can be very septic with a pneumonia. So yeah, you typically won't see it on a chest X-ray. Not sure if that's talking about pneumonia, but you would see that on chest X-ray. And would the final diagnosis be pneumonia? I guess that's pneumonia. Yes, the final diagnosis is pneumonia. Any questions about this case? I know we ran a little bit over. So yes and no. So the heart issues, she has a history of CAD. She has an elevated troponin, but what I wanted to get out of this case is that I want you to look at the whole picture of the patient and not focus on the labs. So pneumonia won't necessarily have a productive cough. In elderly patients, a lot of times they won't have a cough. A lot of times they won't have a fever. But the reason I chose this case, I wrote this case is so that you don't focus only on the cardiac issues, because they can have cardiac symptoms, but it's not always necessarily a cardiac issue. And so a lot of times we become tunnel vision into their first complaint of chest pain, and we focus on that. Or let's say she came in with a cough, and we didn't think about chest pain, and her troponin's super high. If we tunnel vision ourselves into a specific complaint, we can potentially hurt a patient. And so that's why I chose. I know it's kind of tricky. We're talking about the cardiac system and all that, but I wanted to do this case specifically so that you can keep an open mind in the future as well. So there's a lot of questions. Okay, if she was septic, wouldn't her symptoms be more severe? Not necessarily. Elderly patients can present differently than regular healthy adults, and so she doesn't necessarily have to have worse symptoms. But if you look at how she presented, she's lethargic. She doesn't want to eat. Her vitals look pretty bad. She looks septic with those vitals. So I would argue that she does look more sick than not. So pleurisy is more so a symptom, not so much a diagnosis. So she does have pleurisy because when she is coughing, it causes pain, but it's not necessarily the diagnosis. So her diagnosis is pneumonia that's causing pleurisy. Does looking at her past stents help figure out the diagnosis at all? It might if she develops a heart attack. You want to know where those stents were, because you potentially would have to re-stent. Could we ask them if they're having a dry or wet cough? Yes and no. If they have a dry cough, it could be pneumonia. It could still be pneumonia because they're just not able to cough it up. But a wet cough, that could also be pneumonia. It can also be heart failure. We didn't rule out sepsis, so she is septic. I think it's because she doesn't meet criteria. She did meet criteria. So she was tachycardic, she was tachypnic, she had a white count, and she had a fever. So she hit all 4 of those criteria. Why don't we see pericardial effusion on chest X-ray? Because the pericardium, the effusion is within the sac, between the sac and the heart muscle. So you won't necessarily see that on chest X-ray unless you see that water bottle appearance. Shortness of breath is a symptom of pneumonia. So the imaging that we got is pretty much what we need. We probably don't need any more imaging. Really, for pneumonia, it's just really for a chest is all you really need. You can also get a CT if you really wanted. I didn't give you the echo. The echo was normal. I think the person that ordered it was worried about pericarditis. And yes, you just treat with antibiotics. Okay, so the cardiac related issue she's experiencing. So she's not really experiencing any exertional chest pain. So it's not really cardiac chest pain that she's having. So her symptoms were all due to pneumonia. I do have to start the next group because I'm already a little late and I gotta eat something too. So I hope this was helpful. If you guys have more questions in your classroom, just create a stream and I can answer those. I hope you guys had fun.
Thank you.
Thank you.
No problem.
Thank you.
No problem.
Thank you.
Adios.
Thank you.